Hi everyone, I'm Dr. G, and once again I'm coming to you from the United States of America. So, we have all endured the craziness and chaos of the COVID-19 virus for a couple of months now. When should we start thinking about getting back to normal? What even is normal anymore? We'll talk about that in today's video. Okay, so COVID whipped across the world, leaving all sorts of pain and suffering in its wake, and unfortunately, a fair amount of death. And it's certainly not completely over yet. Indeed, there's reason to be concerned that it will never truly be over. After all, though we don't have enough information to say for sure, it's entirely possible that COVID-19 is going to be one of those viruses that keeps coming back again and again, year after year, kind of like influenza does. So what does that mean exactly? Does that mean that we're all going to have to stay cooped up in our homes for the rest of our lives, for heaven's sake? Does it mean that we have to live in some new strange reality where there aren't any public gatherings anymore, no theaters, no concerts? Does it mean that hugs have become a thing of some bizarre medieval past? I certainly hope not. I like me some hugs. But let's all relax, because of course things will get back to normal, or at least they'll get back to what is the new normal, which probably won't look all that different from what normal looked like before. Maybe a few changes, but not entirely different either. Of course that will happen. Remember, the human race has been through multiple pandemics in its past. Hard as it might be to believe, this is not even close to being the worst pandemic that the world has ever faced. But the question becomes, when should we do it? Well, there's lots of different ideas about this. There's lots of different opinions. And at the end of the day, you will have to make your own decision based on what you read and what you learn and what you hear on TV and listening to all the various experts that are out there. And certainly, I don't claim to be more expert than, say, the CDC. But having said that, I'm going to tell you that my opinion is, in some areas, we should be opening up right now, or at least very soon. In fact, I'll go on record saying I think we probably could have opened up in some areas 2 or 3 weeks ago, maybe even a little bit before that. Now, I know some of you are sitting there thinking, seriously? Is this guy crazy? Does he really think that we could have opened up 3 weeks ago or maybe even earlier? And he's a doctor, for crying out loud. Why would he say these things? Well, there are a few reasons why I say these things, and to get to those, let's just look at some of the background facts. First of all, though the response to COVID-19 was, in this country at least, in the United States, in my opinion, well, not great. It was pretty disjointed, it was pretty disorganized, it was pretty dysfunctional. We should have tested much more early on. That way we could have isolated and quarantined more effectively. And even though social distancing has been tremendously helpful in fighting this thing, those could have been put into place earlier in a lot of regions as well. Remember, it's kind of one of those golden rules of epidemiology. The virus is always going to get there before you think it's going to get there. Remember, our first documented case of COVID-19 in the United States was January 21st, which is actually a long time ago. That's 3 months ago. But we didn't start really socially distancing until March. So really, this thing had a month and a half or so, maybe even a little longer, especially in certain states, to spread before we really did anything about it. And then there was the issue of how to treat appropriately, and there was the issue of not quite having enough personal protective equipment to go around, especially for healthcare providers, and there were whole reasons for that as well. I'll go into all that stuff in another video, but the bottom line is, it sure could have been better. But having said that, it could have been a lot worse too. And the reason that it wasn't worse than it was is that even though social distancing maybe didn't happen as early as it should have, nevertheless, at one point or another, to some degree or another, every state in America has implemented some sort of social distancing policy, some sort of stay-at-home order, some sort of a please stay at least 6 feet away from each other order, please stay sick or stay home if you're sick order. Don't stay sick, just stay home if you're sick. And wearing masks and all these sorts of things. And that has been tremendously helpful. So it could have been worse. And the reason it wasn't worse is that we did some things, even if they were a little too late, we did some things that really helped it to not be as bad. Because here's the thing, it isn't rocket science. It's just basic population health. if there's a contagious disease going around, the more we are mashing our bodies together and hugging and kissing on each other and rubbing those mucous membranes all over each other, the more it's going to spread. That's just pretty basic stuff, right? On the other hand, the more we spread out, the more we distance ourselves, the more we put a little space, the more we wear masks, the more we wash our hands, the more we do all these things, the better things get. So it's really all a balance, isn't it? When the virus is brand new, when you don't know all that much about it, you're not sure how it spreads, you're not sure how contagious it is. By the way, if you haven't seen my video on just how contagious the COVID-19 virus is or isn't, please check that out. I think it'll be helpful. But when you don't know all that much about a virus at first, and you're not sure exactly how it spread, and all these things remain an unknown, and there's no immunity built up in the population, that's the time to play it safe. That's the time to take these special measures that will keep things from really getting out of hand. But even though that works, and it limits the spread of the disease, it flattens the curve, it gets that reproduction number, remember that R0 number, that R naught number. You've probably heard a lot about that by now, and again, it's in my video on the contagiousness of the COVID-19 disease. But the important thing is, the more we do these things, these social distancing and all these sorts of things, the more we lower that reproduction number. And when it gets below 1, that means that the disease itself is starting to slow down. It's starting to flatten out. It's starting to get weaker, and it's starting to go away. But if it's all a balance, if there's a time to be really, really safe and really, really careful and really watch these things, then just as the Bible would say, there's a time for everything, a season for everything, there's also a time where we can start relaxing those restrictions. There's a time when we can start coming out of our homes and getting rid of some of that horrible cabin fever that we're all feeling. There's time to start, starting to see other people again and remembering that we're human. Time to get back to work. Time to earn a paycheck and put food on the table again, for crying out loud. Time to restart the economy. Time to start getting back to our usual lives and letting things get back to normal. So, why do I think that time is now? Or rather, why did I think that time could have been even a few weeks ago? And by the way, today is April 28th, to give you some perspective on time. Why do I think that's the case? Well, there are a couple of reasons. The first is just data. Remember, most of the country is now declining in terms of how rapidly the disease is spreading. We're declining in terms of the number of new cases. We're declining in the terms of the number of people who are currently sick or in the hospital. All of those numbers in most areas of the country, not all, are getting better. That's a really, really good sign. Also, remember that we are heading into the warmer months. Now, don't think that just because the weather gets warmer, that means that COVID-19 is going to die and it's going to go away forever. That does not mean that. But most seasonal viruses do get better as the months get warmer. The virus just doesn't flourish under those conditions. It slows down. It becomes less active. Now, will that happen with the COVID-19 virus? Well, we don't know that for sure yet, but based on what we know about similar viruses, it's a pretty good bet that it's at the very least going to slow down a little bit over the warmer months. So that will work in our favor also. But I know you're all probably thinking, yeah, sure, but if we all open up and we all come running out into the street, isn't it all just going to get worse again? Aren't we going to start spreading that virus rapidly again? And it's a fair question, because yeah, that could happen. It all depends on how we do things. If we all just came running out into the streets and had some bizarre spring fertility ritual and started rubbing our mucous membranes all over each other and giving each other big, wet, sloppy kisses, then yeah, that could happen. It all depends on how much of the virus is left in your community, but yeah, that could happen. That is a concern, and that would be bad. So that's why we don't do it that way. If we do things the right way, though, that's much, much, much less of a concern, and things really could work. So how would we do it? The first thing you have to do is you have to remember, well, how is this virus spread? Because if you understand how it is spread, you can understand how you can avoid getting it, even if you're not cooped up in your home. So what do we know about the COVID-19 virus? Well, we know that first and foremost, it is a primary pulmonary pathogen, meaning that first and foremost, it is a respiratory virus. Now, that doesn't mean that the COVID-19 virus can't infect or affect other areas of the body. We know now that the COVID-19 virus can cause myocarditis, which is an infection of the heart. We know it can cause conjunctivitis, which is an infection of the eyes. We know it can cause gastroenteritis, which is an infection of the intestines and bowels and can cause nausea and vomiting and diarrhea. So it can affect all sorts of parts of the human body. However, first and foremost, it is a pulmonary pathogen, and that means it infects the lungs. So that's how you typically get infected with the COVID-19 virus, by breathing it in or by having it spread through your bloodstream to your lungs. And that's also how you're most likely to spread it to other people. Remember, anytime someone is sick with the COVID-19 virus, they're most likely going to be coughing. That's one of the main symptoms that we have to be worried about. And if you're coughing or sneezing, you are spewing all sorts of viral particles out into the air, thousands and millions of viral particles with each cough and each sneeze. Now, a lot of those viral particles are bound up in globules of water and mucus that are referred to as droplets. These are, on the scale of things, fairly large water droplets. They're the stuff that you can actually see spew out of people's mouths whenever they cough. These droplets don't tend to last in the air very long. They're heavy, and they're gonna drop to the ground fairly quickly, or they're gonna drop to the surface of a table or a chair or something like that. However, just because they've fallen out of the air doesn't mean that they're not still contagious. Whatever surface they're on, and it depends on the type of surface, the virus will live on some surfaces longer than others, but anywhere from a few hours to a few days, depending on the surface, it's still going to be there, and it's still going to be viable, meaning it can still infect you. So if you then come around and you take your hand and you put it down on that surface and you get those viral particles on your hands, and then before you sanitize your hands, you then put it to your mouth or your nose or your eyes, one of your mucous membranes, you probably have just given yourself that virus. But there's an even worse scenario. Let's say that the person coughing or sneezing, in addition to those water droplets, which are fairly big, they also, under certain circumstances, can produce what we refer to as aerosols, which are smaller water droplets that contain viral particles. And those suckers can hang in the air a lot longer, and they can travel further. Now, we're still working out exactly how airborne the COVID-19 virus is, and it's been a little bit of a controversy already. It'll probably be a little bit of a controversy for a while yet. But the preliminary data says that it's at least airborne-ish. In other words, under certain conditions and at certain times, it probably does aerosolize and become airborne. Now, I'm going to go into much more detail about that in another video, so be on the lookout for that. But in the meantime, just realize that what that means is you can also breathe those particles in and get infected that way. So, two main forms of spread: contact, where it gets on surfaces, you touch it, you transmit it to yourself, and airborne, meaning you just breathe it in. But if we understand that it spreads via airborne methods and contact methods, that also means we know how we can avoid those things, right? And it's important to realize what the COVID-19 virus can't do. It can't just laser beam across 50 feet of open space and strike you down. It can't do that, thank heavens. It's not gonna lurk behind you and follow you down dark alleys and then, mug you. It's thankfully totally not able to infect you through internet scams or prank phone calls. It just can't do these things, which is great. So that means you just have to avoid those two methods of spread. Now let's start with the worst case scenario. If you have a person who's really infected and they're really sick, they're going to be very contagious. And the reason for that are two things. Number one, they're going to be coughing and sneezing, which is a good way to get that virus out of your body. There is some data to say that it can be transmitted out of your body just by speaking or laughing or maybe even just breathing, but that's probably not going to be near as bad. It's just not going to aerosolize as much, and it's just not going to go as far. But when you're coughing and sneezing, you really put that stuff out there. The other reason that people who are very sick are more contagious is because of the fact that their viral counts are higher. They are shedding more virus at any given time than someone who is not that sick or maybe completely asymptomatic. Now, we do know that people who are asymptomatic but are carrying the virus can be contagious, but that doesn't necessarily mean that they're going to be as contagious as someone who is very sick. Their viral counts aren't as high, they're not shedding as much virus, and they're not coughing and sneezing. So, if you start with a person who is that sick, you need to be careful. You need to assume that if they're in a room and they've been in that room for a while, the virus is up in the air in that room, which means you need to be careful. You need to be using that personal protective equipment. You need to be wearing a mask, as good a mask as you have access to. A mask like an N95 mask that healthcare workers use would be ideal if you're taking care of someone who is sick at home and you're going to be in their room with them for any significant length of time, particularly if you're going to be in there for more than, say, a few minutes. These sorts of things are important, but if you don't have an N95 mask, all is not lost. You can still wear a different type of mask, say a surgical mask or even a cloth mask. They're not as good, but they do help, and they're definitely better than nothing. If you have gloves, great, wear those. If you're even lucky enough to have access to a gown, say a smock or poncho or something like that, or an actual medical gown, that's great too. Remember, those things do need to be sanitized afterwards. But you may not have all these things, in which case spending as little time in that room as you can would be good. Obviously, you have to make sure they're cared for, but as little time as you can would be good. Keeping your distance as much as you can, good. Wearing a mask, good. And then whatever else you can do to protect yourself, that is also good. But each step that you take reduces that risk more and more and more. And that's the kind of things that we do in the hospital. But let's say the person isn't sick. And let's say you stay about 6 feet away from them or further. And let's say you're wearing a mask. And let's say you don't actually touch them at any point, nor do you touch anything that they have touched. Or if you do, you sanitize your hands afterwards. You're not going to get sick. Or at least it's extraordinarily unlikely that you're going to get sick. So you can see how, as long as we're careful about things and we understand how they're spread, you can keep yourself safe, even if there are people who are walking around carrying it. Now, as our cases go down and down and down, then the number of people who are carrying it are going to go down and down and down, and eventually we reach a point where it's just not in our population anymore. Now, that doesn't mean it can't come back, and we have to be on the lookout for that. If it comes back and we have another surge in the fall or next spring or some other time, or even if it's just some other virus that wanders its way into our country, then it's time to get serious again and it's time to socially distance again. But as things get better, we can start coming out more and more. So how do we go about doing that? Well, first things first, you have to decide which areas are ready to open. Now, I'm going to argue that a lot of areas in the country are at that stage, or maybe even were at that stage a few weeks ago. You want to see that those numbers are coming down, down, down. I mean, it'd be great if they were down to zero, but even if they're not down to zero, as long as they're getting better and better and better, then you wait 2 or 3 weeks to make sure that trend continues, and then maybe it's time to start opening up. So how do you go about doing that? Well, if you've decided your area is ready, there's a number of steps you can take. Step number 1. First of all, you start by getting your businesses back up and running. Remember, we need these things. We need all those mom and pop shops to stay in business. It's better for them. It's better for us. It's better for the economy. And also, it's just better physically for us to be out of the house and getting some more exercise, and psychologically, because we're all going crazy, right? So it's good to have that happen. And a good way to start is to start opening up those businesses again. Now, unfortunately, there are some businesses that are probably going to have to sit this step out. If you run a big concert venue, or maybe a big movie theater, or even if you own a restaurant, we might not be quite ready for those places just yet. By all means, the takeout and delivery options are still there. You still rent those movies at home, et cetera, but we're not probably quite ready for big public gatherings again just yet. But some of these businesses, in fact, most of these businesses could get back open again. But as you open them, remember, let's just be sensible about this. Just because they're open, still maintain your distance. Still try to keep that 6 feet between you and the next person. Doesn't mean you have to be all the way across the store from somebody else, especially if it's in a big open building, say something like a Walmart or a Kmart or a Target, something like that. These are big, open, well-ventilated buildings. So the odds of you getting something that is airborne, particularly if people who are sick are staying at home, is very, very, very small. But just to be on the safe side, keep a little distance. And at least for now, masks are probably still a good idea. I know we hate them. I hate them. Trust me, healthcare providers have been wearing them for years and years and years. We all hate them, but we wear them because they keep us safe. So we probably ought to keep that going for a little while. Okay, the next thing is a little bit of a soapbox for me. Hand hygiene. Wash those hands. Sanitize those hands. Soap and water. Hand sanitizer. And honestly, guys, why weren't we doing this before? We all know that that's how many diseases are spread. We all know, forget about COVID-19. Think about rotavirus or norovirus or adenovirus or any of these other viruses that are very common and make us sick year after year after year. Influenza. These things are spread the same way. Wash those hands. And I'm looking at you guys. Women, I don't know if you know this or not. Most of you probably do. When I go into a public restroom, I pay attention. And I would say, depending on which restroom you're talking about, whether it's a gas station or a nice restaurant or whatever, anywhere from maybe 20% to 50% of guys don't wash their hands after they go to the bathroom. That's just gross. Guys, come on, step up. Wash your hands. Remember, you're going to go on, you're going to touch everything, you're going to shake other people's hands, you're going to caress your girlfriend's face. Oh my gosh, she deserves for you to have washed those hands. Wash your hands. Why are we even talking about this? We should have been doing this forever, right? The next thing is super important. If you're sick, stay at home. And it doesn't matter whether you have COVID or not. Let's say you have the common cold, which is actually caused by dozens and dozens of different viruses. We usually don't test for them because people with the common cold usually don't get that sick. But there's tons of them out there, and we all get sick on average with the common cold at least once a year, sometimes more, especially if you have small children. So it doesn't matter if it's COVID-19 or not. If you're sick, stay at home. Keep that to yourself. That's a gift you just don't need to give to anybody else. Also, if you're in a high-risk group, let's say you're 80-something years old and you have lots of medical problems, particularly lung problems, heart problems, problems with your immune system, you might want to sit this phase out too. It's not that you can't go outside, it's just that you're at a little bit higher risk. It's not that you're any more likely to get COVID-19 than anyone else is who's practicing the same sort of restrictions. But if you do get it, you're at much higher risk to have bad things happen. So you might want to be a little bit more careful, at least until we know things are going well. The next step, test, 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 monitor, monitor, monitor. This is one of those areas where I feel like the United States of America, we just really dropped the ball. We should have been testing way more than we did early on. We should have had way more tests available. We should have recruited private industry to say, hey, listen, we know this thing's coming. We know it's going to be here in a month or so. Would you please start making gazillions of tests? Here's the template. The World Health Organization had a very good test that they were using that's manufactured in Germany fairly early on in this thing. We could have used that as a template, or if we wanted to make our own, that's fine too, but let's get that thing mass produced and get it out there so we can actually use it. Because the more you know who has it, the more you can isolate and quarantine, the more you limit its spread. So we should have been doing way more early on. Okay, well, we can't do anything about that now, but moving forward, we sure can. And as we start opening up, let's test, let's monitor, let's make sure that our number of cases is not going back up. It's unlikely that it will do so as long as we're careful, but if it does, we want to know that sooner rather than later so we can shut things back down if we have to. But the good news is that's unlikely. Things will probably go well. The next one's kind of a hard one, and honestly, I don't know how realistic it is, but I'll throw it out there anyway. We probably want to be careful about travel for a while. And when I say that, I mean specifically travel between areas that still have a big problem with COVID-19 and are still seeing their cases go up, or at least haven't seen them start to come down yet, between those areas and areas that are doing really well and are ready to open up. Because if this area is ready to open up, but a ton of people are traveling from here to here, well, then you can see how that might not work. So as much as we can, and it probably would have to be voluntary unless the government's really willing to be very restrictive, we probably ought to say, hey, listen, if you're in one of those areas, stay in that area. Don't come to one of the areas that's opening up, at least not yet. But here's the good news, your area will be able to open up at some point also. It just may be a few weeks later. And finally, once again, schools, colleges, dormitories, big restaurants, concert venues, theaters. Again, these things are just going to have to wait a little while. Don't worry, we'll get there. These things will all happen again, but we got to wait until we get there first. Okay, so you do all these things and then you wait a few weeks to see how things go. And again, you test and you monitor. And if things are going really, really well, then good. Now it's time to open up a little bit more. Maybe you can start saying, all right, let's get some other businesses opened up a little bit. Maybe we'll start opening up restaurants, and maybe we'll have the tables a little bit further apart for now, but we can take that step. Maybe we can start easing up on how far apart you stay from everybody else. Maybe we can start making masks optional. Some people will probably want to keep wearing them for a while, and that's okay. But maybe we can start making them optional at this point. There's lots of different things that we could do to start, opening things up a little bit more, all the while watching, all the while being careful, all the while waiting to see if things are flaring back up again. And now maybe some of those areas that weren't ready to open up before now can start opening up. Once we get past that phase, we can just take it step by step until we're fully opened up again. But let's stop and think about the timeline. Let's say we had started this 2 or 3 weeks ago and it went well. Well, then we could move to the second step about now. And then we wait a few more weeks and we move to the next step. And then we wait a few more weeks and we take the next step. And then by that point, we're probably pretty much back to some semblance of normal. And if you look at that timeline, you'd realize that would all happen possibly before the end of May, or at least by the first part of June. Wouldn't that be wonderful? And, if it doesn't go that well, again, you turn around and you shut things back down and you give it a little bit more time and you try again. But this could all take place relatively soon, and in my opinion, at least some areas are ready to do that right about now, or even a little bit ago. Now, having said all that, I'm going to make a plea that some of these restrictions just never go away, ever, even after this is all gone, or at least as gone as it's ever going to be. First of all, wash those hands. That should never go away. It should never have been gone in the first place. Wash those hands. The second thing is, if you're sick, stay at home. That should never go away either. I know you don't want to. I know it's miserable to be at home sick, but it's even more miserable to come out and be sick and get everybody else sick. So if you're sick, stay home. And finally, let's not forget the lessons that we learned with all this. These are some really painful and quite frankly deadly lessons that we have learned. Remember, the United States of America has somewhere in the mid 50,000 deaths right now. The entire world, so far as we know, assuming the information is even remotely accurate, has had just over 200,000 deaths. What that means is the United States has had 1/4 of all the deaths in the world. Recognize that we represent a very rich country, a very privileged country, a country with good infrastructure, and we only represent 1/25 of the world's population. How on earth do we have 1/4 of the cases? And 1/4 of the deaths, I mean? Well, it's because we could have done things better. So let's learn from this. Let's remember those lessons that really we should have known before, but we definitely should know now, right? And also, let's keep things in perspective. As horrible as this has been, certainly this has disrupted the economy and our normal way of life more than just about any other infectious disease, at least in my lifetime, and probably in many of yours as well. But let's keep perspective. Remember, regular old influenza kills upwards of 30,000 people in the United States alone every year. So if you say, well, all right, we're at 55-ish thousand deaths from COVID-19 right now, and let's say that those numbers are going to keep going up for a little while, and we may end up somewhere in the mid-60s or even close to 70,000. That's terrible. That's tragic. But every year, influenza kills about half that many people, and it's been doing that every year going back decades and decades and decades. And some years it's a lot worse than that. If you think about, for example, the 1918 Spanish flu pandemic. And there have been other years that have been pretty bad too. So there are lots of things that do this. And as we get more used to the COVID-19 virus, as we have better treatments for it, as we have vaccines, hopefully, as we start building up an immunity in the population, it will get better. It won't be as bad as this first time around, or at least there's every reason to think that that will be the case. We don't know for sure till it happens, but there's every reason to think that that's quite possible and in fact even likely. If we want to really think about perspective, think about this. Malaria, which is not caused by a virus, it's caused by a parasite. And we don't think about malaria too much in the United States of America. We're very lucky not to have a big malaria problem. But malaria kills more than 1 million people worldwide every year. COVID-19 is not going to kill anywhere near that many this year, or at least not near that many that we know about anyway. We don't have a lot of really good data from some parts of Africa and Asia, and so maybe it's a lot worse than we think. But based on the numbers we know about, COVID-19 is not going to kill as many people as malaria kills every year. Now, malaria isn't considered contagious because it can't spread from one person to another. And again, if you haven't seen my video on the contagiousness of viruses and COVID-19, give that a look. But it's not classically considered contagious. It's spread by mosquitoes, not from person to person. But still, think about it and remember to have some perspective on all this. This is bad. It's been really bad. but it could have been worse. And there are things that are worse. So to wrap things up, if you live in an area where things have really started to get a lot better, maybe now is the time to start looking at opening things up. And I know a lot of states around the country are considering doing that very thing. If you're interested in looking at what I think is a pretty good plan for opening things up, look at the state of Colorado's plan. The governor there, along with all of his advisors and medical experts, I think have done a really good job formulating a very good plan, a plan that sounds actually quite a bit like all the things that I just described. So if you want to look at an actual plan that is being implemented right now, take a look at that. And if your state's not quite there yet, or maybe your county or your city, hang in there. We will get there, but we need to do it correctly. Okay, I think that's about it for now. I'll be working on my next video, which is how airborne or not airborne the COVID-19 virus really is, and we'll look at the data behind that and why my personal opinion is that the COVID-19 virus is airborne-ish, and I'll explain all that. But in the meantime, all of you out there, keep up the good work, and remember, every day, try to find a way to make the world a better place. I'll see you soon.